Hi, Dr. House. Today we have a wonderful new topic for our series that is called Prolopuncture. Can you describe what that is?
Yes, thanks for having me again on the program. And Prolopuncture is a non-surgical joint repair. You know, a lot of people these days having to get joint repairs. And you see these commercials on TV of these joint manufacturers that are getting sued because these manufactured joints aren't working for people, and surgery is always a touch and go type of thing. And Prolopuncture means proliferation of cells. What we're going to do is we're going to grow cells in the joint so they don't become bone on bone, or if there's a tear in your joint, we can mend the tear. Because typically what happens is when you cut yourself, you get that fibrous scar tissue that mends a tear, but that doesn't happen in your joint. So when you tear a ligament or your meniscus, which is the meniscus is the cushion in the knee, you have the top of the knee and the bottom of the knee, and the meniscus is the cushion in between. And then you
Yes.
have ligaments on the side. And then in your hip, you have your hip joint, and then you got a ball and a socket. And between the ball and the socket, it's called the labrum. It's a cushion. And then also in your shoulder, you have a labrum, which is the cushion between the ball and the socket. And then the rotator cuff muscles all join right here. And what happens is when you tear one of those muscles or tendons or ligaments, they stay torn for life. So what Prolo is it's dextrose. It's actually sugar. And what this sugar is a scarring agent. So what happens is when you have a tear, I'll inject this dextrose, this sugar, and it irritates the tissue for a couple days, and it lays down scar tissue. We also put a little B12 in there to help the healing process. And so the Prolo means proliferation of cells, growing of cells. And the reason I had this started this was I learned it in China, and they've been doing it for about 100 years in China. And about 20 years ago, I had gotten in a car accident and I tore my anterior cruciate ligament, your ACL ligament, in my knee. And I had one of my good friends, an orthopedic surgeon here in Sarasota. He fixed it. And when you tear your ACL, you can't do anything for 6 months. So after the 6 months, I started to rehab, and I couldn't even walk up and down the stairs without my knee blowing up. And so I went back to him and I said, "What'd you do to my knee? My knee's worse than it was prior to surgery." And he goes, "Well, I did you a favor. When I was fixing your ACL, I saw you had a tear in your meniscus, so I cleaned it out." And I said, "What do you mean you cleaned it out?" Well,
You
what
took
happens is
all
when
the
you,
tissue?
yeah, the tissue, I had a
Oh
tear
my
in the
God.
tissue. And so when you have a tear in the
No
tissue,
cushioning.
yeah, the cushion would separate, and when the bone touches each other, that's when your bone gives out, or it catches, or it buckles. And
And
so when
causes
doctors,
pain. And causes
yeah, it's a
pain.
ton of pain. And so I said, "Well, what did you do?" He goes, "Well, we cut the tear out so it doesn't tear anymore." And I looked at him, I said, "Well, isn't that kind of like cutting cushion out of your couch?" And he's like, "Dr. House, I've never heard anyone put it that way, but that's exactly what it is." And of course, my next question is, "Well, why would you do that?" And he goes, "Well, that's just procedure. That's what I was taught in school." And I said, "Well, have you ever had knee surgery?" And this guy does hundreds to thousands of knee surgeries every year. And he's like, "No." I'm like, "It doesn't work. My knee's worse than it was." He said, "Well, there's nothing else we can do." So I learned this procedure over in China, and the reason they call it prolopuncture is we actually stick the shots in the acupuncture points. That's why it's called puncture. We're using the proliferation shots in the acupuncture spots. So what I did was I injected this into my knee, and it irritated the tissue, and it filled in the hole that he made. And not only that, your meniscus is soft tissue. It made all that tissue into hard tissue. So it's like having hard tires on your car versus soft tires on your car. So now my knee was better than it was prior to surgery.
Let
And
me let me rewind one second, Dr. House.
Sure.
Are you saying that the surgeon had left your knee with no cushioning, and by infiltrating with your procedure, you regrew tissue that is harder than the natural
Okay,
cushion
so
of the meniscus?
yes, that's a great question. You kind of got it right. So what happens is, if you see right here, I have a little tear. Now
Yes,
watch when I push on it and see how it separates like that.
yes, yes,
And so what happens is, when that separates and the two bones touch each other, that's when your knee locks up or it buckles. And so they don't want that tear to keep tearing because it doesn't mend it. So they cut the tear out. So it's an old sewing technique. So it
yes.
doesn't tear anymore.
I
But
understand
now
what
there's
he
a,
did, but I
yeah,
want to understand that with your procedure,
uh-huh.
you pretty much reconstructed your knee to a better state than it was before the injury.
Exactly. I grew the tissue, and I not only grew tissue in there was fibrous tissue, I made all that meniscus tissue into hard tissue now. So it's like having, like I said, like hard tires on your car versus soft tires. So my knee was actually now better than it was prior to surgery.
And that is amazing. Which brings me to the next question. How does this procedure compare with stem cell patches? I've heard that they are very effective to be used in joints to do precisely that. With stem cells, they can regenerate our own
Yeah.
cells, right?
Well, they not only do they do it with patches, they also take stem cell out of your body and they inject it into where the tear is. Now, the thing with stem cells are relatively new. They're only about 15 to 20 years old. So we're still kind of finding out what stem cells do. But what stem cell does is it replicates the cell that you take it from. For instance, let's say you have a bad heart. They can take a stem cell from your heart, they can grow it in the laboratory, and then it can fit you perfectly because it's made out of your stem cell. So it replicates the exact cell that they get the stem cell from.
Yes.
Now, the problem is they're getting the stem cell from soft tissue. And we need fibrous tissue to mend the tears. Think about it. If you cut your skin, you need that fibrous scar tissue to mend the tear. But what they would do is they would take stem cells from your skin, and that skin tissue wouldn't be able to mend the skin. It needs to be fibrous tissue. So they're just missing it just by a little bit. In
Yes.
fact, this dextrose is so incredible that when they would make the heart and they wanted to put it back in a person's body, they couldn't get the blood flow to go. So what they did was they took dextrose and its sugar and they blew it up like cotton candy, and it was like little capillaries, and it helped the heart go back into the blood flow, go back into the person's body. So this dextrose is absolutely amazing. So a
Wow.
lot of people, they hear about stem cell, and stem cell definitely has its, it definitely does things for people, but it doesn't help with injuries. It helps with replacing organs. And
Yes.
so they're still learning the things, because you ask a stem cell person, they'll feel good after their operation, but where are they 2 or 3 years later? Because I actually see a ton of stem cell patients that got stem cell done to me, and a year later, their knee or their shoulder or their hip is exactly what it was prior. And so we end up doing the Prolo. And like I said, I did mine 15 years ago, and my knee is still as incredible. I couldn't even walk up and
Wow.
down stairs without my knee blowing up.
That is an amazing result. Now, I also know that some patients do not qualify for stem cell when they don't have good cells, like a cancer patient. They
Yeah.
cannot do the stem cell use. I mean, they cannot inject treatments with their stem cells. They directly disqualify any cancer patient.
Yeah.
Whereas with your intervention, with Prolopuncture, they could have good knees whatever amount of years they have, even if they are cancer patients, right?
Yeah, well, yeah, see, so that's kind of you're mixing two things. I mean, someone who's got cancer and someone who's got a joint injury are two different type of injuries going on, two different type of diseases. And
Yes, I
see,
know, but it can happen in the same
yeah,
patient, and you
so
want them to have good quality of life. So why
exactly.
would you say you don't qualify for this treatment because you have cancer? Well, thank you very
Well,
much. I will be with
yeah.
joint pain the rest of my life.
Yeah. So the first thing we have to do is get an MRI. An X-ray won't do it. So an X-ray only shows bone. It doesn't show soft tissue. Because what happens is if you've worn down so much of the tissue in your hip or your knee, and it's worn down the bone, and what happens is anything I grow, the bone will eat it up because the bone is worn down. So you need to have a little bit of tissue left in your joints for me to fix it. But if it's completely bone on bone and the bone is worn down, it's all chewed up
It might
from
not
being on the
work.
bone. It's not going to work. So the
So
first thing
what
we
kind
do
of
is need to get an
joints?
MRI.
What kind of joints is this more helpful for?
So it's incredible for a torn meniscus. It's good for partially torn ligaments. When a ligament is completely torn, it retracts, so I can't fix that. It means it goes farther apart. But when they're together, I can mend it when it's partially torn. I can also fix a rotator cuff tear, because what happens when you have a rotator cuff tear, it doesn't retract, it just goes up like this. So I can fix the rotator. I can fix the labrum in the shoulder, and I can fix the labrum in the hip, and I can fix any partially torn ligaments in the hip. So once again, the first thing a patient wants to do is get an MRI so we can see if they're a candidate for this. And if they're not a candidate for this, the only other thing they can do is a joint replacement. And
I would
sure.
like to feature, if that is possible, I would like to feature your own website, which is beautiful, and we have it here. And here we have the title for Prolopuncture. People can schedule an appointment directly from here by choosing this button, right?
Yes.
And here you have exactly the explanation that you started this video with, and the fact that it's an injection of B12 and dextrose in acupuncture points. That is so good. And then how is prolopuncture performed? So this is dextrose is also a natural thing like B12, or what kind of substance is it?
Well, it's B12, which is all natural, and dextrose, which is sugar. And what dextrose is a scarring agent. And so what that does is it irritates the tissue and it makes the tissue lay down scar tissue, which mends tears. And that's why I was telling you the
Yes.
stem cell doesn't work, because they get the stem cell from soft tissue, and we need fibrous scar tissue to mend tears. And that's what makes this so ingenious. And they've been doing this now for close to 100 years in China. So it's been proven over the test of time. And like I was saying, stem cell is still relatively new in the United States.
Okay.
So we are going to give people a free consultation if you say you saw this video interview. It's $150 value. I have a free consult with myself for 30 minutes to see if you're a candidate for prolopuncture, and I can explain more. But the easiest thing for you to do is go to allnaturalhealingsrq.com, which we have
Yes.
on the screen now, and go to Prolopuncture, and you can read more of the description, and you can also read a bunch of testimonials. I have literally helped thousands of people from getting surgeries over the last 20 years with this. And I'm not only the doctor, but I'm a patient. So most doctors don't get hurt in the profession that they're in. So they don't really know what they're doing really works. Well, I can tell you, I know this works because I've healed myself with it.
And we have 3 testimonials here, pretty long testimonials of 3 people that consulted with you, and you have your phone number here, or you can schedule the appointment online from Dr. House's website, All Natural Healing SRQ, which is the airport code for Sarasota, Florida, right? Beautiful place in the world.
Well, I want to introduce the new program that we're putting together, our new program that's going to be for anyone who's watching. It's about health and wealth, and I want Paula to explain that to everyone.
Yes, I actually have partnered with Dr. House because he is all natural health, something that I have promoted like as a digital marketer for a long time. And I believe that it's no coincidence that these two words, health and wealth, have only one letter in difference, right?
No doubt.
Health
No
and
such
wealth.
thing as a coincidence.
Yes. So I believe, and we know even from the Bible that money is good energy. So if we want to be healthy, wealth also helps our health. This is a good mantra, right? And
Yes.
we will put together a project that will help all of us grow as entrepreneurs. Because many of your patients, Dr. House, and you have a big list, like 6,000 people, many of those patients might be interested in having a side hustle. You know, they might have their profession, but they might want to start their own online business, something on the side to earn another income stream, okay? Even passive.
The New Year's coming around, and everyone wants health and wealth for the New Year's.
Exactly, exactly. And we will not underestimate the last quarter. There is a lot that can be done between October and December. We will maximize this last quarter, and then by January the 1st, you can really be having a profitable business, okay? We have the tools, and we will show you how. This will be all part of the same thing, because we have a holistic approach to health. So you don't want somebody healthy and broke. It doesn't go together, right?
Doesn't go together, yeah. It's a holistic approach to health and wealth.
Exactly, exactly. And I believe that we're going to have a lot of fun, and we will answer questions. We will support you with the technology and everything. So stay tuned for that next chapter that we're going to launch this week and next. So thank you very much, Dr. House, for your
Thank you for having me.
For your wealth of knowledge, okay? And we'll talk to everybody soon.
All right. See y'all next week.
Thank you.